Hello, I'm Dr. Ben Lynch, and I will be seeing you at the North Carolina Integrative Medicine Society Conference in June. And I'm going to be presenting a new topic, which I've never presented before, and that is on ADHD. And as a kid, well, as an adult, actually, I always thought that ADHD was just kind of those labels thrown around so Big Pharma can throw another prescription at somebody. But I've come to realize that is a significant problem. And if you support the individual properly, they will feel amazing and their struggles are actually gone. And we all think that medications can be useful for this, and they can be, but the medications for ADHD can actually be pretty problematic for the brain long term. And there are environmental causes for ADHD, there's genetic issues, there's food and dietary ones, there's lifestyle habits. So all these things play a significant role. And so I'm going to be sharing a lot of my findings that I and my research team have been digging into for the last few years on this, and the successes with ADHD that I've been seeing on individuals I've been working with, and also some of the struggles that I've been experiencing and the potential side effects of the nutrients that are most often used in ADHD treatments that are non-pharmacological. So, and one thing I also want to bring up too is that we think of ADHD as a stagnant label. So, and some people will say, I have ADHD. And what I've noticed is it can change from ADHD to ADD and back and forth. And so while the topic is ADHD, I will be also discussing ADD because you need to be able to identify both. And so I won't be focusing too much time on labs, but a lot on signs and symptoms and questions that you can use right there in the clinic with your patient to spot if it's ADHD or ADD, because labs, frankly, are not always the solution. But a very, very good intake, the right questions will get you the right answers, and then you can provide the right nutrients to get the right outcome. So I look forward to presenting all this great information with you in June, and I'll see you then.